Dawndy, back to you.
All right, thanks a lot. Well, we are back with our doctor, Dr. Albert from Lexington Medical Center, letting you ask your stroke-related questions. Let's go to one doctor that just came in a little earlier this afternoon. This is from Amy Corbett, and she says her mom had a stroke that disabled her for the last 9 years of her life. They said it was caused by a piece of tumor in her heart that broke off and went to the brain. Is this common? What would you tell Amy?
What I think she's describing is atrial fibrillation, and atrial fibrillation is a common condition, and what it's characterized by is an irregular rhythm in the heart. And with that irregular rhythm, clots can develop, and those clots can in turn shower the brain. And so blood thinners are medicines that we use to prevent blood clots from developing. Controlling heart rate is another intervention, but as far as reducing the risk of stroke itself, blood thinners like Coumadin and other similar medicines that have come out recently are what are recommended. And in fact, she asked a second part to that question, saying how long should someone stay on blood thinners before it actually leads to internal bleeding? Sure. Oftentimes it needs to be lifelong. If they have this atrial fibrillation, the risk is going to be lifelong so long as you have atrial fibrillation. And you have to weigh risk versus benefits. So if the bleeding risk is greater than the benefits, then you have to let that trump the risk of reducing stroke. But in general, if the medicine is regulated appropriately, you need to be on it lifelong. Great information for our viewers. What I'm going to do is take this and the interview we did earlier and post that on my Facebook page and our WISTV.com website a little later. Dr. Albert, thank you so much. Thank you for having me. Thank you. See you again at 5.